As you guys know, I do a lot of lip reductions, and what I wanted to do is give you a little bit of a tutorial on what you need to know after a lip reduction. It is a little bit different from a standard wound care, and patients been asking me, because you also most often are probably going to fly in for this. About 80% of my patients that have this procedure done with me, either for an ethnic lip reduction or a silicone or Gore-Tex fat grafting correction of the lip type of thing, need to know what to do afterwards and what to expect. Basically a few things. The incision is going to be slightly visible, and the sutures are going to be visible as well, so you need to understand that. Because a lot of my patients that have this done fly in, a lot of them fly out the same day. Because this is under local anesthesia, there is no sedation provided, and do not worry, you're not going to feel anything sharp, anything burning whatsoever. I've really got this procedure down very well. I do 1 or 2 every week that people fly in for this. You have to understand that with that area, you're going to have visibility in that incision line. But you can plan to fly out the same day or the next day if you like, because the sutures that I put in are dissolvable. So I want to talk a little bit about what to expect in the aftercare that's involved. Number one is that I want you to be on a soft diet for about 3 days. And that soft diet means really not something that requires chewing, that you could bite through my sutures or tear through it. So I want you to be basically mainly liquids and anything that doesn't require mechanical chewing if possible. And if you do have to chew something, just make sure you do it with your mouth closed so the lips don't actually get bitten on. The other thing that's important is, and the other thing is good, especially if you're thin and you don't want to lose weight over 3 or 4 days, take some Ensure. It's a great nutrition supplement. So if you're going to fly down here, bring some Ensure with you, E-N-S-U-R-E. It's a nice dietary supplement to keep your caloric count up. I also want to have you minimize a lot of excessive animation, such as smiling and stretching and licking. There's this tendency that people have after I've done something to lick the incision over and over again. Don't do that, because that can compromise the result in terms of infection, etc. As far as the sutures that I use, they start to fall out anywhere between 3 to 14 days afterwards, even up to 3 or 4 days early. I had one lady try to go trim them at day 1 or 2. That's not a good idea. You don't, even if it's hanging out a little bit, leave it alone. If the sutures start becoming a little bit more like hanging after, let's say, a week, you could trim back the areas that are falling out, because they're going to, when I say dissolvable, part of it dissolves. And if you think about, this is your lip here, there's a loop that goes through it. The inside part dissolves, the outer part may fall out. The lips heal so fast that I'm not worried about it. I've had a couple patients. I just did a gentleman from Atlanta, and he came in a little panicked on Saturday before he flew out and said he saw a little bit of bleeding. It's okay. If you see a little bleeding and the suture line looks intact, you're fine. What else do you need to know? One thing we do is we give you some steroids. Now, steroids are very low dose. These are not mega high dose steroids. They're used just to cut down the swelling. I usually give you a couple pills before we do the procedure. You take it every 6 to 8 hours, a couple pills. I'll give this to you. You don't have to go buy it. And you just go through about 2 days or 3 days, and it'll just cut down some of the swelling afterwards. And I think that's helpful. With steroids, there's a couple things you need to know, just so that I can get this out of the way. There is a chance that you could have some stomach aches, and it's a good idea to take that with food. It's in our instructions. And also, maybe if you have ulcers, to be careful with that, not to take it, or to take it with some Zantac or Pepcid over the counter. That will help cut down in terms of the discomfort in your belly. So that's something that's important for you to understand. It's not going to eliminate swelling, and especially 2 days after the procedure, you can have a little bit more swelling, and that's typical, and then it starts settling out. In terms of not being able to be seen, it's very hard for me to say that. I've had one lady that took about 6 weeks before it really noticeably the swelling came down, but that's very unlikely. I would say if you have a sizable lip, especially if it's a deformity, you can probably see a difference even within a few days or even immediately afterwards, and that's usually a good sign. So in other words, the swelling doesn't outweigh the size of your lip. If you have a pretty large lip to begin with, I've reduced the size and there's a little bit of swelling. My feeling is in most patients, even with the swelling, your lip is still smaller than it was before. Granted, there may be a little distortion from the swelling, but it should be sizably, in most cases, not every case, actually smaller. The visibility of the incision line, you probably saw some of the testimonials on my website. It usually is not so visible even after 1 week or so. Now, let's talk about wound care. The thing is that you see in my wound care video, I talk about using peroxide. Do not do that. Peroxide on a lip with the dissolvable sutures is not a good idea. I repeat, it is not a good idea. All I want you to do is keep that area moist. How moist? well, as moist as possible. And we're going to give you some bacitracin or Neosporin to start with. It's a good idea, especially if you're flying in here about 2 to 3 days in advance, if you have some Neosporin that you want to use or bacitracin, just put a little bit on your hand, make sure that you're not allergic to it. In about 5% of my patients, there can be some itchy, burny response. If you have that with bacitracin or Neosporin, please just give me a call. Let me know that. I will, and stop the product, obviously. That's extremely unlikely. But in case you're getting sort of more inflamed and itchy and burning, it's usually due to an allergic reaction to the antibiotic ointment. You don't need antibiotic ointment. You can actually just use a standard cream like Aquaphor Vaseline as well. I tend to like the antibiotic ointment because, you know, it's an area that's a bit dirty, so to speak, your lip. So it's an area that's important that you keep that moist with preferably an antibiotic ointment. Always people ask me how moist. I would say to the point that it's actually glistening, and you may even see some product on there. It's really important for your first 7 days. So if you can possible, no lipstick if you're a female for the 7-day period, nothing else on there, and really just treat it with kid gloves. And you're going to start seeing some of the sutures start unraveling at 7 days. You can start trimming back anything that's really, really loose after 7 days. Before 7 days, I would really ask you not to trim anything back, and just be careful. Those sutures will fall out pretty quickly. Hopefully that's a good summary of things you need to know in terms of what to expect afterwards, as well as how to take care of it. So just keep it moist. I want to repeat one more thing. You want to do it, keep it moist, even sometimes up to 6 to 8 times a day, because the lips do dry out. So that's very, very important for you to understand that. And hopefully that little tutorial was helpful.